So next we're going to, thank you very much, Ryan Boyden, President of the Paramedics of Winnipeg Local 911, to be heard with respect to Winnipeg Fire Paramedic Service strategic direction. Happy that you're here to talk to councillors today, not just through the media, but in person on behalf of your members.
Well, thanks. This is my first time speaking at this committee, so I'd just like to say thank you to Councillor Rollins, the committee chair, for inviting me to speak here today. I'd also like to thank fellow member councillors Edie, Orlicau, and Santos. So anyway, I guess my point here today was I wanted to speak on the 2020 strategic direction detail proposal that was recently provided to City Council that City Council has been left with deciding whether they want to move forward with it or not. Before I continue, I'd just like to introduce myself a little bit for those that don't know me. I'm an advanced care paramedic within the City of Winnipeg, WFPS. I've been doing this for 20 years. I've done this from the time that we started moving into the halls together with our firefighter friends and colleagues. We used to steal each other's lunches and throw them in the garbage in the beginning, to be honest with you. And, I can proudly say that the men and women of the Winnipeg Fire Department, I consider them friends, colleagues, and they do their job very well. Recently I've had to attend a funeral for a paramedic, and I can say that there was about 500 members of the department present, and you really couldn't tell how many were there from the fire department and how many were there from the ambulance service, which is a great, it's a great thing to note 20 years into this endeavor of combined response. I can also tell you, along with being a frontline paramedic, it really means that I'm the guy that when you call 911, anybody here in this room, if I'm working, I may end up actually at your house, at your door. And that's important to note, because that means that for 20 years I've had the opportunity, and I do call it an opportunity, to have meaningful conversations with both firefighters, paramedics, training staff, officers, and I can assure you that some of these conversations that take place either at noon, 3 o'clock in the morning, 5 in the afternoon, it really centers around what are we doing here and how can we improve some of the challenges that we face. I can simplify it by saying that many of the conversations we have with solutions really begin and end with the question of, have we overshot the balance that we originally sought out to fix in the first place. 20 years ago, we did a combined response model, and it was to help mitigate ambulance needs to attend to medical calls and decrease their utilization rates. And 20 years into this model, our ambulance utilization rate is double what the national standard is. That means we're busy. We're at around 65%. That doesn't mean that we have 35% more to give. That means we come into work, we get in the ambulance within the first minute or so, and we come back to the station at the end of our shift. 20 years into this model, our huge, heavy fire trucks are broken from ripping around the city, going to medical calls. Calls that aren't always time sensitive, but those fire trucks, their main function is not necessarily attending to 85% medical calls, which leaves these fire trucks broken and the department needing to lease fire trucks at an outrageous cost. I don't know what that cost is off the top of my head. I apologize, by the way, if I forgot some of my papers getting my 7-year-old out the door to school today. So I don't know what those costs are for leasing fire trucks, ladders, and such to make sure that we have a response, but it's something that I think we need to look at. 20 years into the model, I still can't answer people when they ask me, what does it mean when the department tells us that the fire department is still understaffed, requiring all the overtime that we pay for? And yet for some reason we can still afford to send a fire truck, fire apparatus to a medical call that's not time sensitive necessarily, without us compromising our fire response to the citizens of Winnipeg. I think we have to eventually, after 20 years of doing this, if we're going to go another 15 years and $160 million, I think we need to start asking, what are we really looking to do here? We either have enough fire resources in the city of Winnipeg to cover all fire-related calls, or we have enough fire resources in the city to do all the fire-related calls and 20,000 medical calls. And at that point, I'd just like to know, which one is it? Make no mistake, I'm not a subject matter expert of the fire response needs. So this service may very well need to renovate, replace, consolidate to a total of 24 new fire stations. Make no mistake, not being a subject matter, I don't know if all the staffing that's been recommended is required. But what I can say is that it feels to paramedics out there that the ambulance paramedics anyway are being used as an ATM to get those fire stations built. And it's short-sighted and it's insulting. I believe that if the plan is to put an ambulance in every fire station out there, I believe then what we're doing is we are using a fire-centric model to provide medical coverage for the citizens of Winnipeg that may not be relevant today. The 2020 strategic direction detail does not take into consideration the fluidity of change that the paramedic profession is currently experiencing. The 2020 strategic direction detail makes no mention of innovative ideas like paramedic superstations. Superstations that have been built in cities like Ottawa, where paramedics attend to them and they report to work. They get in their truck and they go care for the citizens of Winnipeg. They don't need to check the oil. They don't need to double check and recheck the supplies, which takes time out of their day and time we frankly don't have. It also fails to mention one of the most innovative approaches to modern healthcare, which is a rapid response vehicle, treating people in their own homes and leaving them there to recover. Essentially, community paramedicine. Especially with today's COVID-19 virus, we can expect to see more issues like this, health issues, that require people to perhaps not be taken to the ER. Perhaps what we should be doing is leaving them in their homes to care for themselves, along with community paramedics. So, I'm not going to take a whole bunch of your time up here. I'm just, quite frankly, quite disappointed that we didn't investigate a paramedic response model, since 85% of all calls that come into our paramedic dispatch are medical related. I believe the three main reports are significantly fire response centric. Like I said, the need to place an ambulance in as many stations as stated is presented as a time-saving measure, which is an important aspect of putting out a fire. But it overlooks a more efficient ambulance response model that could be more palatable in a shared health cost-sharing agreement, such as paramedic-only stations. I ask that this committee do their due diligence in finding answers to some of these questions and at least taking in the information anyway. The company that we hired to give two out of the three reports is ESCI, Emergency Services Consulting International. A simple Google search revealed that ESCI is actually a consulting firm of the International Association of Fire Chiefs. I thought that to be interesting being a paramedic in this city. I also know that in 2010, a city by the name of Palo Alto in California also commissioned ESCI to do a report that we did. And when it came forward that this company, from the lead consultant as reported in the paper, when he was asked, have they ever recommended less staffing, the answer was no. Not the entire time they've ever been used to consult and provide a standard of cover risk assessment. That's crazy, if you ask me. But is it possible that one could conclude that there may be institutional bias with this company, perhaps? I'll leave that to this committee. We know now that the underwriter survey is actually outdated. It was done in 2014, and I remember seeing a memo that said how important this underwriter survey was, and yet it's taken us 6 years to get it out public. I question why. Did any of these reports take into consideration that the healthcare changes to Winnipeg specifically, where we've gone to 3 ER departments, requires that ambulance and community paramedics response models are mobile. And as I said before, 85% of all calls to our dispatch are for medical reasons. The stop-the-clock mentality of the fire department response model is less relevant today for paramedicine and I don't concept is considered within these reports. I'll finish by saying Winnipeg paramedics are frustrated. Not too long ago, the mayor and council stated that they wanted to get out of the paramedic game and asked the province to take over the costs of the ambulance paramedics in the city. Now we read reports that the city is needing cost sharing with Shared Health to help prop up a failing model, help replace aging fire stations. I want you to understand.
Extension.
I only need another minute anyway.
That was a movement there, I saw. All those in favor. That was carried. Go ahead.
So I'll close again by saying I'm not against this model. There's a lot of good things with this model, by the way. One of them is the squad vans that the fire department uses to mitigate the need for an ambulance on scene. These are incredible people in these squads. They care for the people that are at risk in our community, and more of them may be needed. But I don't see that in the report either. And I'll admit, I haven't gotten to the very end of the report, and I'm not sure if you have. Then my 7-year-old is not at your house, I can guarantee it. But I've certainly tried to get through as many as I possibly can. I'm not against this model, but what I am against is just simply housing ambulances in fire stations because that's the way we've always done it. Thank you.
Thank you very much, Mr. Whiten. Council Orlico.
Yeah, just so I know you know. So Shared Health, just to clarify, I understand this, and maybe I'm wrong. Shared Health pays for ambulance services.
All of it.
So you talk about a number of ideas today that are exclusively ambulance related.
That's correct.
Have you brought that up with the province yet?
I believe that the WFPS is currently in talks with Shared Health to discuss said things, but like I said, none of it in the report.
Have you, your organization who's brought these models up, because really we are just a contractor of Shared Health, have you brought this up to the province at all? Some of these ideas you have?
Certainly.
Sure.
Yeah.
Thank you.
A couple months ago, last month, how many months ago did MGEU Local 911 meet? How often do you meet with the province? You mentioned that this is your first time being here in 20 years. How you must meet more regularly? Is that twice a year?
To be honest with you, Councillor, we discuss all the time. We're constantly discussing through paramedic organizations such as the Paramedic Association of Manitoba, the City of Winnipeg, the provincial paramedics, and we're trying to find a way that we can become more efficient. We mentioned the RMF McDonald possibly cost sharing or at least utilizing the fire hall out in Waverly West. There's no reason why we couldn't use that same mentality and talk about Metro Winnipeg and try our best to perhaps use the ambulances in these bedroom communities to help out. Perhaps increase their utilization rates so that we can get to people quicker. But all of it still has not been looked at. The things that haven't been looked at are the things that are working in other cities. And I guess my question is have we looked at that? Have we looked at what they're doing?
You're using inflammatory language like ATM machine.
That's not inflammatory, Chairperson. I simply mean that if to build these fire halls, these fire stations, we have to put an ambulance in there. I'm just saying, I just think that there's a better use of provincial tax dollars if we're going to have some type of cost-sharing element with the City of Winnipeg.
Your position is you no longer want ambulance bays in stations?
I'm saying that there's a more efficient way to do things.
Not no longer having ambulances at stations. Is that your position as president?
If we move to a super station, a paramedic-only station, I would say there may be efficiencies to be found, yes.
Is that what you're aiming for, is super stations for paramedics?
That's an option for sure, Councillor.
So,
Councillor Eady.
so just to be clear, just to follow up, I just want clarification. So you're saying in the city where they have this super paramedic station, all the ambulances are there for the whole city in one location?
I think you can look at Ontario where there's various different
In one location or?
platforms. And Ottawa, from what I'm talking of, some have more than one superstation, depending on the size of the city. But yes, essentially,
Yeah, that's what
employees or paramedics.
That's what I'm trying to get at.
Yeah,
So is there no efficiencies to be found in utilizing the same building, right? You're saying there's no efficiencies in combining keeping apparatus equipment.
No, of
On the
course
same
not.
building.
Of course not. No, for sure you can find efficiencies. I'm looking at finding additional efficiencies or other options that provide those same, if not more, efficiencies.
In alternative structures called superstructures that you were mentioning with ambulances only in them.
That's correct.
And that's what you're talking about presumably to the province.
Not only that, but these rapid response vehicles, if we're talking about stopping the clock and time is of the essence in our calls, we've never really looked at the cost effectiveness of having a sport utility with a highly trained paramedic in it to mitigate the need for an ambulance as well.
You've
And
never
these-
looked at it in terms of your conversations with the province, you're saying?
No, I've looked at many different things with my conversations with the province councillor. What I'm saying is, has this committee looked at rapid response vehicles to perhaps mitigate the need for an ambulance, thus saving the wear and tear on a $1 million fire truck barreling through the city of Winnipeg? That's all I'm asking.
I don't think that I see further questions. Thank you very much for
Thank
your
you.
presentation today. I think this concludes